Fetal monsters in cattle. Hydrocephalus is when there's an unusual amount of fluid accumulation in the ventricles, which is hydrocephalus internus, or the subarachnoid space, which is hydrocephalus externus. Their brain looks full of fluid. For cleft palate, it can be internal, so not visible from the outside. This is why you should always check the calf's mouth after birth. Surgery is available at only 4 months, but until then the calf needs to be bottle fed twice a day, every day. For chondrodystrophia fetalis, which is a chondrodystrophic fetus, this is a development abnormality of the bones and cartilage. It is often caused by viruses, and we can see short and thick bones, even the cranium, with a huge epiphysis. These calves are usually stillborn because they have a rigid rib cage, which means they can't breathe. For anasarca, this is a gross, general fluid accumulation in the subcutaneous tissue. And ascites is fluid accumulation in the abdomen. And for the schistosoma reflex, this is when the spine bends caudally on itself and there's no abdominal wall, and the organs are free in the fluid. This calf has to be born through a C-section. For parasomus alumbus, this is when the calf has no caudal spine. And for ankylosis, this is when the calf is born with fused joints. They can't move as they are in a fixed position, and these calves have to be born through C-section. And an amorphous globulus appears after a normal calf, but it doesn't affect it. If you cut it open, it does not contain anything. So these are the single monsters. But the double monsters include dicephalus, also known as the Janus face. This is when the calf is born with basically a conjoined face. Or Pegasus. This is fusion between twins. They can be conjoined through the thorax, the umbilical, the thorax or the umbilical, the head, the sternum, the pelvis as well.